When I started out in microbiology, so that is the disease of bacteria and viruses, and I really only focused on bacteria initially as an undergraduate. As a graduate student, there I learned about virology. But at the end of all those studies, I felt like at that time we had vaccines for the viruses, we had antibiotics for the bacteria, and I felt like there wasn't a new frontier in these fields at that time. But I felt like I needed to find a new area that was going to broaden. And I had been reading a couple of papers in some new journals about cancer research, and I took a cancer research course, and I was sold. Really, the challenge in prostate cancer is not having good models to really understand how human disease develops. And so very early on in my research career, I was aware of that. And so I partnered with clinicians who had access to tissues, human tissues, that I could actually use and try to build models that better recapitulated the human disease. I thought, this is a new frontier. This is a big problem. I had new family members that were dying of cancer. It's a big problem, and I understood it was a new frontier. So that's really why I chose it. Subsequently, I've had many more family members die, and so I really have seen it from both sides. Myself, I was diagnosed with cancer, so I understand it also from the clinical side as well. So trying to make those decisions about treatment, about, are you that 1% or that 5% or that 20%? Trying to make those decisions are really hard. Cancer arises in a certain cell type within a tissue, but that tumor is in the context of other cells, right? And it's those other cells that we're interested in because they contribute to how that tumor develops. So the tumor doesn't develop in isolation. It develops what we call the surrounding cells, or sometimes referred to as the tumor microenvironment. So we're very interested in understanding how the other cells are impacting that tumor development, initiation, and progression. And so really the chip was important to put those different cell types together into one culture system, because our existing systems are really limited to one cell type in one dish. And so that was the beauty of the chip, is that you can actually put multiple different cell types together and really ask questions about how each are interacting with each other and how they contribute to the overall tumor. So I've seen it from all sides, and I'm so glad I went into this area. I think it's very challenging. A lot of people are interested in this area. It has a very high profile in the media, so that creates a lot of competition. But I wouldn't want to do anything else.